Surgery for brain tumors involves the patient being put under general anesthesia, which means that they're completely asleep for the entirety of the procedure. In some cases, we'll actually wake the patient up during the surgery so that we can monitor the area of the brain where we are operating on. Therefore, if we're getting close to the part of the brain that controls speech, we'll notice that the patient can't speak as well. Also, if we're getting close to the part of the brain that controls movement on an arm or a leg, we will be able to detect that early. In order to perform our surgery, we'll have to make an incision on the scalp. In the vast majority of cases, I shave off as little hair as possible, which tends to be just the amount about the thickness of the size of a pencil. Once that incision's made, then we get down to the bone. A window of bone is created that gives us access to the brain. At that point, we perform the surgery where we try and resect as much of the tumor as we can safely without damaging the surrounding brain. Once we are done, the bone goes back on and it's secured in place with titanium plates and screws. These screws stay in forever, they don't set off metal detectors, and they still allow the patient to get an MRI afterwards. On the skin, I close with absorbable sutures that will just fall out over the course of the few weeks after surgery, and it doesn't involve having to cut the sutures out again. Depending on the size, location, and type of tumor, we may approach it in a variety of different ways. This includes surgical resection, an open or needle biopsy, or radiosurgery, which includes tools like Gamma Knife. Gamma Knife involves delivering stereotactic radiation to a tumor. The benefits of Gamma Knife radiosurgery are that it does not involve making an incision. It can be usually completed in under an hour, and the patient tends to go home that same day.